All right, we are live with Toronto's Associate Medical Officer of Health. Dr. Vinita Dubey is joining us today for a back to school special. Thank you so much for joining us, Doctor.
Oh, my pleasure.
So we've had parents and concerned guardians sending us their questions all week, lots and lots of back to school questions. If you have not had a chance to submit your questions, you can still do so in the comments under this video, and we'll try to get to as many as we can. My name is Dilshad Burman. I'm a web writer for CityNews and 680 News, and I will be moderating this chat today. So let's get started, Doctor. Lots to get through today.
Okay.
All righty. So let's start first with concerned/confused mom. She asks, should I send my kids to school? What are the factors I should consider before making a decision?
Okay, so there's a number of factors to consider. First, look at your child or your children. How well can they follow instructions? What age are they? How well do they learn? Can they keep a mask on? Can they follow instructions? Will they follow instructions? And then you want to look at your home environment. Are there vulnerables in your house or in your social circle that you need to consider? And what about the logistics of, could you handle online learning for your child, or is that not a possibility? Do you need to send your children because of work? And then another component to think about is, what are you going to do when your child is sick? Because I think that's another piece that has to be played in. If they have symptoms, it's going to be different now. And so you have to be prepared for that piece as well.
Okay, lots to consider there definitely before you make that decision. And it's just 2 weeks to go now. Another concerned parent, as we see regularly, most cases are in Peel, Toronto, and Ottawa. Why is there no regional approach for increasing measures in these spots in terms of schools reopening?
Okay, so exactly. We have seen higher cases in the Greater Toronto Area, in particular in those areas that were mentioned. And it's a Ministry of Education that what approach were used, and they haven't actually taken a regional approach. So in a high school in the Greater Toronto Area, they are going to be doing what's called an adaptive model, where they will have half a day in class and half a day online. And so right now it's only been applied, that adaptive model, for the high school and up. It has not been applied for elementary students. I think as things progress, we can definitely expect to see some variations in what school boards do related to COVID and providing school in certain parts of Ontario.
Okay. Olga asks, if a child at school wears a medical mask and someone in the cohort is diagnosed with COVID-19, then why does the child need to stay home for 14 days? Is it the same situation in doctors in hospitals and such? If you're exposed to somebody, you have to stay home for 14 days.
Okay, so this is another good question about, why are we treating...
Sorry, Doctor, your audio is breaking up. Let's just go back a little bit.
Okay, so can you hear me now?
Yes.
Yeah, okay. So when you're dealing with, in a hospital environment, we're wearing hospital-grade personal protective equipment. And so we have a medical mask on, some sort of eye protection, whether it's a visor or a face shield or goggles. If we're actually seeing a patient who may have, we wear even additional precautions. And so if that patient has COVID, we have full protection. The ability for them to actually contaminate us, to infect us, is very low. And we would still be notified and have to watch for symptoms, but could still continue to attend work. Again, when we attend work, we are, again, wearing our personal protective equipment. So should we come down with COVID, the likelihood of us spreading it to others is very little. In a classroom environment, even though children will be wearing masks, we're giving them mask-free breaks. They can take their mask off when they have lunch. When they're outdoors, we recognize that there may be times when physical distance, and they're wearing a cloth mask, which is not a medical grade mask. And so those are some of the reasons why the approach is different. In Toronto Public Health, what we do when there's a case anywhere, including in a classroom, we do what's called a risk assessment. And so we actually evaluate, was everyone in that class considered a cohort and could have had close contact with the person who was sick? Maybe the sick individual who got COVID was not even actually in school when they were contagious. In that case, the cohort, nothing would have to happen to them. So we do that risk assessment, and then based on that, give recommendations or requirements to people who may have been exposed to the person on whether they have to self-isolate for 2 weeks or whether they could continue to attend school but might have to just monitor for symptoms.
Okay. And then Chelsea asks, how high do the case counts have to get before we shut down schools again? The rising number in Ontario makes me very nervous about what will happen when schools open, and we have an additional potential route for infection. So knowing that there is a limit would help, she says.
Yes, it would help, right? So what we are doing is we are keeping close eye on the case counts. They are starting to creep up. And so I think we have to recognize at what point would we recommend, I actually just had a meeting today with the Toronto District School Board on this matter to start talking about at what point would we maybe say use an adaptive model or go to online learning because the case counts are too high. And so our staff at Toronto Public Health are keeping close eye on those numbers, or reviewing the literature to figure out what might be some thresholds to determine that. It won't likely be a specific number. I mean, will it be the number for all of the city? Would it be for particular neighborhoods, particular schools? If they have a couple of cases that they can't link back, it might just be a school issue, might not be a neighborhood issue. So all of these things are things that we're keeping a close eye on so that we provide that guidance on when schools need to shift models or consider closing.
Right. So that guidance will be coming based on your conversations with TDSB then.
It's also based on our surveillance. Surveillance means we're keeping a close eye on the numbers, who's getting the cases, where are the cases, what are the characteristics of the cases, to be able to inform public health measures. And deciding on a public health measure like closing a school is definitely in the purview of what Toronto Public Health would be doing.
Okay. And then Peter asks, and we've had this before, but definitely good to reiterate, are kids being asked to get tested before going back to school?
In Ontario, that is not a requirement. I know that is a requirement or a recommendation in other places, but not in Ontario. Again, when we get tested, the day that we get tested, the test result is only as good on that day. And it doesn't necessarily, if you test negative, it doesn't necessarily mean that you're incubating. If you have symptoms, absolutely, you should stay home and get tested. But we're not requiring all staff or students to be tested before they start school.
Okay. And then Priya asks, students, when they go back to school, are being asked to wear masks all day. Will they be breathing more carbon dioxide, and will it cause any future problems with their lungs?
So I think it's important to mention that, you know, healthcare professionals can wear masks all day as well. And there have been no associated links with higher carbon dioxide and with adverse health effects. I think the important thing to note is that students will be wearing cloth masks or disposable masks that are equivalent to cloth masks, and they actually are breathable. And that's part of, when you pick a cloth mask, you need to pick a material that is breathable. And by breathable, it means that you can, when you exhale, the CO2 will be able to leave the mask. It's not just building up inside there. So that's important. The other important thing to note is that we've asked schools to build in mask breaks throughout the day. So you will take your mask off to have your lunch. You will take your mask off when you're outdoors, for example. And so it won't be a continuous, 5 hours straight of wearing a mask. And so there will be breaks built in as well.
Okay. And then a Toronto teacher asks, can you please explain why limits for indoor gatherings don't apply to schools, but they do for, other indoor gatherings?
So a lot of our guidance for example, gatherings are related to public situations, and schools are separate. We provide guidance separately to schools. The indoor gathering limit is still, though, 50. And so this is why we have told schools not to hold assemblies because an assembly would be 50 students. There should not be any classrooms that have 50 students or more. The indoor gathering limit is at 50. So there should not be any classrooms that are 50 or more, for sure. And indoor gatherings within schools, we have recommended that they be postponed. If they were to proceed, they would have to follow the same rules of no more than 50 as well. Now, the whole school itself, like that's per room, the whole school itself can be more than 50. Just like in a workplace, you could have a building that would have more than 50 people who would attend the workplace, or you could have a store where you might have more than 50 people, as long as you can maintain that physical distance in the store.
Okay. And then there's a couple of questions regarding the actual distancing, like the feet, how many feet. So there's concerned parent, there's Dee Marie and Leslie, who are all asking the similar question, which is, why is it okay to have 1 meter physical distancing in schools, but it's 2 meters everywhere else? And what is the actual safe distance then? Is it 1 meter or 2 meters?
So the answer is it could be both. The more distance, the better. And so we know that 2 meters, the reason why we picked 2 meters is if I were to cough here and you're 2 meters or more away from me, the likelihood of my droplet spreading to you is less. We know, though, that 1 meter is better than no meters. And the World Health Organization actually recommends 1 meter. Other places like the UK are recommending 1.4 meters. So you are seeing variance in terms of what people are recommending for distance. And so what we do say in our Toronto Public Health materials is where 2 meters is not possible, and it's not always going to be possible, maintaining as much distance as possible, 1 meter or more, will be helpful.
Okay. Okay, and then we've got a couple coming in right now, just live. Sheila asks, when a child is deemed sick at school and cannot be picked up right away, what happens to that child? Who is looking after that child? Are there special measures for children who, start showing symptoms at school?
Yes, so that's part of the protocols that school boards have had to develop. It includes a wellness room or an isolation room where if there's a sick child, or even a staff who can't go home right away, they are to go into that room. There are precautions in place, personal protective measures, cleaning precautions, so that the child could wait with observation until they can be picked up. And then there are measures in place to make sure that the place is clean, that the staff who are there are wearing appropriate personal protective equipment, for example.
Okay, that's very good to know, very reassuring. Let's see. This is interesting because we were talking about this last week as well. Could you please explain opting in and opting out of in-person classes and how that will work?
So I think this is a question for your particular school or school board on how it's to work. What we know is that the Ministry of Education have asked school boards to develop 3 plans. So one plan is regular learning. And for Toronto, that means elementary schools will be in regular classes, full class times. And then there's the adaptive learning, which in Toronto means high schools will have half-day classes and half-day online or remote learning. And then the third one is remote only, online only, where for some of the boards in Toronto, it means that they have set up a whole online school that your child will be a part of. So those are the 3 models that each school board has to develop and has developed.
Okay. And then Concerned Father asks, what are the attendance guidelines for kids with coughs, runny noses, nausea, etc.? I can see a situation where my child may be coughing one morning this week or have a runny nose the next week. Would they need to be tested twice, and would they need to stay home for 14 days each time they have one of those symptoms?
So we're trying to firm up our guidance here. Every morning, there's no question that each child, each student and staff is going to have to complete a screening questionnaire. And so it's going to say, do you have a new or worsening cough, runny nose, trouble breathing, all of those symptoms? And if you do, you will have to stay home. And the recommendation is that you go and get tested. If you test negative, then 24 hours after your symptoms get better, you can actually return to school. So suppose you had a cough 1 week, you got tested negative, and then a week later, now you have a new symptom. Well, it's hard to say what's causing that new symptom. And so we're hoping to get further guidance on that. But certainly getting tested, if the test is negative, your symptoms go away and you go back to school, that's a very clear path that will likely remain.
But then, so like you said, if they have a cough or something the following week, the recommendation is to get tested a second time then?
If it's a new cough, it's a worsening cough, right? Like if they had a cough the first week and it was negative, it hasn't changed, it's maybe because they have asthma, well, then that's a different story. So there will be some assessment that will be required. But if it's then now they had a cough when we had symptom of COVID. And so just because they had a cough and they were tested doesn't mean now they have another symptom that you're sure that it's negative.
Okay. And then this is a related question. Another concerned parent says, I have 3 children. Between them and my wife and I, there's lots of runny noses and coughs and throughout a typical school year. If one of the kids has to stay home or my wife has to stay home, do all the kids stay home until we get a negative result, or for 14 days, or is it just for 24 hours till the symptoms are gone?
So again, this is part of, we're hoping to get a firmer guidance on this. If you have someone at home who has a symptom, we are not requiring right now that the whole household needs to stay home. That person, though, should go and get tested, because if they come back positive in that situation, then the whole household would need to stay home for 14 days. And so that's currently what our guidance is. Again, some of these finer details we are firming up, so that we can be able to be consistent and provide that guidance in the school setting.
Okay. Let's see. Trisha asks, why are high school kids only going back 50% of the time? She says that they should be in school full time.
So again, high school is using the adaptive model where it's half day in school, half day online learning. So as I understand it, they will be getting a full day of learning. It's just only half of it will be in school. The reason for that is recognizing that the cases in Toronto and the GTA are still present. The risks are higher. And so in high school classrooms, it can be difficult to physical distance. And so if you have half of the students in the morning, the other half in the afternoon, you can have smaller classes. High school students are also able, don't require babysitting, for example. We also know that high school students are more closer to adults when it comes to COVID.
Yes. That
they may be able to get COVID or spread COVID more similar to adults than, say, younger children, who we think may be more likely to have milder symptoms, may not spread it as much. And so that's another reason why having smaller class sizes in the high schools has been adopted.
Okay. And then let's see, there's some bus questions here. Lynn asks, what are the recommendations for students on school buses? Do they have to wear masks? How many kids per seat? That kind of thing.
So you'll have to check with your particular transportation company what their recommendations are. In general, wearing a mask on a school bus is a good idea. Making sure you do the screening at home before you come to the school. As much as can be done, we are recommending that students try and sit in the same spot so that if someone on the school bus has COVID, you know who has been around them compared to the whole bus. So these are the types of measures that you can expect. But what specifically is being recommended for your school bus, I would ask your transportation company.
Absolutely. And actually, this is a good follow-up question that we were just talking about. If a student has to stay home for 14 days, do they automatically switch to online learning then, or do they miss 14 days of school?
Again, that's going to be a question for your school board to ask them. From what I understand, the exclusive online learning, you have to choose that, and that is your only mode. If you are sick, though, and are at home, then I would imagine it would be that the teacher who you currently have who would make arrangements for you, as would be the case when you're sick otherwise. So, but the particular details on that, you should follow up with your school and your teacher on those details.
Okay. And then Nadia asks, will people be able to call Toronto Public Health if they feel that their child's classroom is not safe?
You're always welcome to call us. If you live in Toronto, if you're a resident of Toronto, if you go to school in Toronto, our number is 338-7600. And I think so if you have specific questions about a classroom, about your school, please go to the school first, because I think that that's the first measure for you to go to try and get your concerns addressed. But you are always welcome to call us, absolutely.
And then Susan has a question about recess. How will we have kids social distance at recess when they're allowed to take their masks off? Because that's going to be a little bit risky.
Yeah, so outdoor play is important, and it's also less risky for COVID. And so not wearing your mask while you're playing outdoors is something that we are saying is allowed. We are still recommending that students, as much as they can, maintain a physical distance, but recognizing even when they're outdoors and they're brushing by each other, they're running past each other, that if they can't maintain that physical distance, that risk is lower. And so would give them a mask-free break and allow them to play.
Okay. Let's see. So we spoke about cohorts last week and kids having to be possibly in different cohorts. So one parent asks, you mentioned that kids might be a part of different cohorts in school and after-school programs. What are the safety measures taken for those kids who will be in more than one cohort?
So the safety measures are actually outlined. The Ministry of Education has a before and after school care guidance document that those before and after school care programs will have to follow. They will be very similar to what's being held in schools. And so I think what you should recognize is, while you have a child that may be a part of two cohorts, an after school cohort and an in-school cohort, the measures, though, that will be in place will have to be followed so that the risks can be reduced.
Okay. And then this one, we've had a similar question before. Julia asks, how healthy is it for kids to be masked up all day when they don't have proper ventilation in class?
So we're not recommending that kids be masked up all day. We are definitely recommending that kids have mask-free breaks throughout the day, recognizing that masks can be difficult to wear for the whole day. And so I think that that's important to note. And I think sending, one or two masks, clean masks in a clean bag for your child will also help, so that if the mask gets hot or, there's saliva inside of it, that the child can be at liberty to put that in a dirty mask bag and use their mask, because I think that will help as well. Maybe you tell them they have a mask for the morning and a mask for the afternoon that they change after lunch, and then one spare one, for example, is something that you could do so that they could tolerate the mask and learn to wear it.
Okay, and then we have another one coming in from Kathleen right now. She says, elementary kids are eating lunch at their desks in their classrooms. Given that they'll be indoors and won't be spaced 2 meters apart, isn't that going to be risky without masks?
So some of the recommendations for eating lunch are, in that 2 meter distance as much as possible. So maybe it might mean spreading out the classroom, maybe not eating at your desk, but spreading out chairs so that you can keep as much distance as possible. Not talking during lunch. I mean, the actual act of eating doesn't necessarily transmit droplets, but if you're eating at your desk and you're not talking, as much as that can be maintained, that will be helpful. And as well, we've recommended to school boards have lunch outside. I mean, as much as that can be done during a school day. Maybe during lunch, the windows are opened as well. So those are some of the measures that can be put in place to reduce the risk. Okay,
and then actually, this is a related question. You mentioned that classes might be held outside if and when possible, but what happens in the winter?
So, in the wintertime, obviously learning math outside is not something that's going to be possible, but being outdoors as much as possible is still something that's recommended. And so, I think that, we have to try and adapt. And even in the winter, if some of our learning, maybe a science unit or something could be done outdoors, we can try and do that as well.
Okay. Cece asks, is it true the teachers' unions can shut down the school year under their agreement for their health and safety?
I'm not familiar with the union and the answer to that. I think what is important is that staff, whether it's the teachers or other staff working in schools, should, when they will be given personal protective equipment to make their work environment safe. And that's actually a requirement for any staff, no matter what kind of work you do, that you should be provided the proper protections so that you can do your job and be protected.
Right, absolutely. And then Rob asks, can you explain the difference between having social distancing rules in restaurants and stores, but not in schools?
Our main message is the same regardless. Keep your physical distance, wear a mask, wash your hands often, and stay home when you're sick. And that has been our message to the school boards as well. And recognizing that in some classrooms, in some schools, that sometimes you won't be able to maintain that distance at all times. And so when you can't, that's when, that's why wearing a mask is important, because it will give you that protection when you can't maintain that physical distance. Making sure that we don't have people in the classroom who are sick, who can then spread droplets. So they're all layered approaches to help reduce the risk, especially when you can't keep that physical distance. But as much as you can, that is still our recommendation.
Okay. And then this one, we had a question about the cleaning in schools. So this question is, who is monitoring how well schools are cleaned and how often they are cleaned? Who is monitoring that, or who do they report to regarding the cleaning of schools?
So Toronto Public Health, we've provided guidance. We've relied on some of the guidance that's available from Public Health Ontario, from Health Canada, Public Health Agency of Canada, to provide guidance to schools on cleaning. And they have protocols in place for cleaning. And so each school, you would have to ask your principal who is the one who's going to monitor the cleaning to make sure that it's done. But there are certainly policies, procedures, and guidelines in place on cleaning, and some of which we have provided.
Okay. And then we have another question coming in live right now. Samantha asks, our daughter is in grade 7 and there may be shared instructions between her class and different classes, as in the students would remain in their own class while the teachers switch back and forth throughout the day. So are the kids at a greater risk of COVID exposure if there are shared instructions like that?
We've provided guidance to the school boards when a teacher has to go between classrooms, how that can be done safely. And so, the teacher wears a mask. I mean, the risk is that the teacher spreading their germs to the students, and also the teacher picking up germs from other classrooms. And so making sure that that teacher who goes between classrooms has a mask on, and maybe if there's plexiglass available, keeps that 2-meter distance at all times, really, because if they can keep that 2-meter distance despite teaching in front of the class in different classrooms, the risk to themselves and the risk to the class will be actually very low.
Okay. And then Stacy asks, and again, this is a question a lot of parents have a concern about this. My son has asthma. Do students in these situations get to have mask breaks? And she missed what you said about mask breaks earlier.
Yeah, so I mean, we're recommending that all students have mask breaks because we recognize that wearing a mask for the whole day is going to be difficult. And
sorry, Doctor, we lost your audio just a little bit.
Okay. Yeah. Even someone who has
My apologies. I think we're having a couple of technical difficulties. Just could we go back to the asthma question again?
Sorry, maybe I'll just do something here to see if it might help.
No, we're a little bit in and out. Sorry about that. We're just having a couple technical difficulties. We're going to try and fix this. So. No. Sorry, doctor. Let's try it once again. Let me make sure I've got everything set up properly. There we go. I think we're better now. Oh, it's on mute.
Hi there. Okay, sorry about that.
Sorry,
okay,
no problem.
Yeah, so every child is recommended to have a mask break for sure. And those who have, a medical condition where they couldn't wear a mask or might need more of a mask, well, then that might be, accepted. If a child needs a mask break when there isn't a classroom mask break, well, you could talk about having procedures in place where they might go to a place to make sure that they have a 2-meter distance, take the mask off, take that mask break, and then put it back on, for example.
Okay. And then we just have a minute left, so we're just going to quickly do this. Is it really safe for our kids right now to go back to school? Shouldn't we at least wait till December or later?
So I think every parent has to make that decision. Some parents who feel that it's not safe to send their kids back can certainly choose the online option. Every school board is required to have that option for exactly that reason. And I think, we will continue to follow to decide at some point, maybe schools need to be shut down. And that is something that, you can recognize that Toronto Public Health will be following that to be able to make that assessment.
Absolutely. I think we had quite a few questions about whether or not schools are going to shut down if there's a second wave. And like you said, you're going to be following, the progress and recommend from there, basically.
That's right. And I think you can expect that we will see cases of COVID in schools. One case in a school doesn't mean that all schools need to be shut down. Even 2 cases in a school might not even mean that school needs to be shut down. And so we certainly do not want to see COVID spread. And, putting things on hold, shutting things down is one of our public health measures. And so we will, and I want parents to know that that's a decision for public health. School boards can also be conservative and make that decision, but often we do it together. But it is not something that will be left to the school boards. It is a public health action.
Right. Okay. Thank you so much, Doctor, for joining us. On that note, we are now at 1 o'clock already. Thank you to everybody that sent in their questions, and we'll keep monitoring the situation, and we'll chat with you next week.
Okay. Thanks, and sorry for that technical difficulty. Bye.
Thank you. Bye-bye.